Hello everyone, today I'm going to be talking about how to use an MDI, metered dose inhaler. The nurse should include how to set up the MDI with the spacer, how to administer the medication, what the patient must do afterwards, and how to care for the MDI and spacer. The advantage of using a spacer with an MDI is that more medication is delivered to the lungs by allowing the patient to better control the flow of medication. What is a spacer? A spacer slows down the medication delivered from a metered dose inhaler. This is the metered dose inhaler. As you can see, there's a cap here, open to deliver the medication. And here there's some numbers. You can see how much I have left. I have 37 left. And here is the medication. We can see better the numbers here. And the expiration date and the lot number. We always have to follow the 5 rights. Right patient, right route, right medication, right dose, and right time. Usually that kind of medication patient has to take 4 times a day to help to reduce the asthma symptoms. This is one type of medication, Flovent. It's fluticasone propionate, 120 microgram inhalation aerosol. And it comes sometimes this is another medication. This is Ventolin. It comes sealed. We always inspect to see if it's sealed, if it's the lot number, if it's expired or not, and how with the medication it's in a proper packaging. See, this one is sealed, and I have name of the patient here and how many need to be taken per day and all the side effects, morning and evening. Now I'm going to be talking about the spacer. This is one kind of spacer. It comes in a plastic bag. This one is for child. It has a mask on it. It comes with an instruction inside. You see there's instruction. And the plastic, we can put name, date, room number, and put any notes on it. How many comes? This one, it's a child, has a mask on it. And here is where the medication goes. Comes like this. I'm gonna show you another one. This one is an adult. Has a cap on it. Oh, sometimes you can use an extra mask with an attachment. I don't have the attachment for this one because this is for nebulization, but nebulizer. But you see, this one you can attach if the child is small and doesn't really help too much to take the medication. We can use this one here. It comes in an attachment that I don't have here. And this one I was talking is this one is for adult. We always inspect the packaging, see if it's clean, keep in a dry place, check the instructions. Comes also with instructions. And here's the chamber, and you see the opening and has a valve inside. Both has a valve. You can see there's a valve. Then when you put the medication on it, the medication doesn't go away. What we have to explain to the patient, he has to sit in a really comfortable position on a chair. And before he take the medication, he has to exhale, take all the air from his lungs. He takes all the air, and he's gonna seal his mouth around this opening here. In the case of the child, he will put this one in his nose and the mouth. But for an adult, he sealed the mouth properly around the opening of the chamber. And I'm gonna switch this one for this one. Oh, you have to shake a lot. This one you shake. And then ask the patient to exhale. And after he exhales, you put the medication here on the chamber. You see now it's became quite white. Then you ask him to seal his mouth here around, and he makes a noise. When the noise is gone, means there's no medication left on the chamber. He holds the medication for a few seconds, his mouth closed, like 2 or 3 breaths, but he keep it closed and his mouth closed, and following doctor's order, he might or might not have to repeat again the procedure. Then he's gonna put again the medication and inhale. When there's no noise, means there's no medication on the chamber. It's important to teach the patient that he has to wash his mouth after he takes the medication. This will remove the medication left in the mouth and prevent thrush. He can rinse and throw away the water, or he can also swallow, but the important thing is he has to swash some water in his mouth. After he's done with this, after every week, he can open this one here, this one open from here, and he will rinse the chamber in a warm water. You can leave it soaking for 15 minutes. This one open here as well, or this one open here. We can put everything in a small container. We wash with warm water, a little bit of soap, rinse with fresh water, and then leave it air dry. Be sure there's no water residue inside to repeat the procedure. It's important to check that, keep it clean and keep in a dry place to prevent any mold or anything that can grow inside. And this is it for today. Let me know if you have any questions. I can bring my supply to school and I can teach you how to use the MDI, the medication, the chamber, and in case if it's a child, the mask. Thank you very much and have a good day.